welcome everybody to today's webinar. My name is Faye McGuinness. I'm the Head of Workplace Wellbeing Programmes at the mental health charity Mind. And this is number 6 of our Mental Health at Work Commitment webinar series that I'm really happy we've been developing in partnership. We're in partnership with CIPD, Business in the Community, This Is Me, and the City Mental Health Alliance. It's been a great series. I know many of you have joined all 6 of the webinars, so great to have you. But today's webinar is specifically focusing on Standard 6. And Standard 6 is around increasing transparency and accountability through internal and external reporting. And I'm really pleased to be delivering this with Alison Unstead from City Mental Health Alliance. And Alison is the Director of Strategy and Operations, so she's going to be talking through this standard in more detail after I've done some scene setting. And I'm really pleased that we've also got Sean Maywood from PwC, and he's going to be bringing his experience of actually implementing this standard and what it looks like at an organisational level. So really great to have you both today. I'm just going to start with a little bit of housekeeping. I tend to forget this, and you think I wouldn't, having done so many of these webinars. But just to say, we are recording today's sessions, so if you don't want to be on camera, feel free to turn your cameras off. But we're recording them so that we can host them on the Mental Health at Work website, so that you can watch them afterwards, you can share them in your organisations, and you can share them with your networks. Everybody is on mute, but we're encouraging people to put any questions into the chat function throughout the session. We will have a Q&A at the end, so ask away, ask anything that you want to myself, Alison or Sean, and we'll make sure we get those questions answered at the end. So I'm just going to start by setting the scene and talk about what the Mental Health at Work commitment is and why we launched it. If you have been on the other webinars, forgive me, you would have heard this before, but we know that there might be some new people on today, so we need to set that scene really. So what is the Mental Health at Work commitment? Well, essentially, it's a set of 6 standards that we believe all employers should be implementing as the bare minimum to prioritising workplace mental health. And the 6 standards really help organisations think about how you create well-being for everybody, so how you create and promote well-being for all, how you tackle the causes of poor mental health in the workplace, and how you can support people that are experiencing poor mental health. So the 6 standards have quite a lot in there. I think we can admit there's quite a lot to do, but effectively what you can do is if you start to implement those standards, you're able to tackle those 3 buckets that I've just spoken about. And what we say is that signing up to the commitment isn't saying that you're going to do it all immediately. It's a journey, it's the start of the process, but it provides you with a framework so that you can start to think about the things you need to do to make this a priority. And so why do we need the Mental Health at Work commitment? Why did we launch it 1 year ago? So Business in the Community run a yearly Mental Health at Work report, and they run it in 2019. And what that report told us is that for those who had experienced poor mental health at work, 39% of those people said that work was the driver and the cause of that poor mental health. And also, when we asked, or PwC asked people about whether they felt comfortable talking generally about mental health, 51% of people said that they did. So there was still a high percentage of people that were still not feeling comfortable to talk about mental health generally in the workplace in 2019. And we knew in 2019 and at the beginning of this year that the cost of poor mental health to employers is around £45 billion every year. And £29 billion of that is made up of presenteeism. So not people being off work, not people being sick, but people being in the workplace at their best and therefore not being at their most productive or engaged in the work that they do. So before COVID hit, I think it's fair to say we were already facing a crisis in terms of workplace mental health. And then COVID hit, and we knew that it was going to have a massive impact in terms of how people were feeling around their mental health at a population level, but also very much how people were feeling about their mental health in work. But I'm really pleased to say that the PwC have just run their 2020 Mental Health at Work report. And I just wanted to kind of pull out those 2 key stats again. So the number of people that have experienced poor mental health at work the number of people or percentage of people saying it's due to work has risen from 39% to 41%. Now, that is a rise, but actually I believe that rise would have been much larger if employers hadn't put mental health at the heart of this pandemic. And I believe that actually that small increase is a sign that employers have prioritised this during the last 6 months. And in terms of the percentage of people that feel comfortable talking about their mental health at work, that's gone up from 51% to 56% this year. So again, actually, the cultures that employers are creating are encouraging more people to feel open about their mental health. And to see that increase during this really tricky year that we've had is really positive. So I think COVID is providing us with an opportunity to really think about how we fundamentally shift the way that we view and design work for better mental health. And I think that's brilliant. And the Mental Health at Work commitment will continue to support you to be able to do that throughout the rest of this pandemic and into the future. So, as I said, today's session is looking particularly at Standard 6, and just a reminder of what's in that standard. So it really talks about your internal and external reporting on key measures and how you can do this, and the activities and the impact that you can measure using standardised frameworks. And we're going to talk about some of those things today with you. So I'm going to now hand over to Alison, who's going to talk you through this standard in a lot more detail before we hand over to an in-conversation between Alison and Sean. So over to you, Alison.
Can you hear me?
Yes.
Good. Right, lovely. Thank you so much, Faye, for that introduction. I'm really pleased to be joining you for today's session. So just as a bit of an introduction to the City Mental Health Alliance, for those of you who perhaps have not heard of us, we are the community for mentally healthy businesses. We were set up in the City of London about 10 years ago now by 3 senior business leaders who, in the aftermath of the financial crisis, had recognised the increasing levels of stress within their own organisations, but also, sadly, the number of suicides of city workers. We're 10 years on now. We are now a global community with over 50 large global members. And our work is essentially twofold. So firstly, we have continued to grow our leadership network. We have a platform for leaders to bring them together to share best practice, to share thought leadership, but most importantly, really to encourage them to go back to their own organisations and influence good mentally healthy practices. But we also now work very closely with wellbeing practitioners, HR leads, to help them develop their mental health and wellbeing programmes. We also have a number of additional services for non-members, so if you have any interest in learning a bit more about us, then please do visit our website. Anyway, on with today's session. So as Faye has introduced, today's session is on organisational transparency and accountability. And this is through both internal and external reporting. So by reporting on mental health and wellbeing, organisations are really showing a responsibility and an accountability for the mental health of their organisation and their workforce, obviously in particular. It is about making a public and a visible commitment for actively supporting people within their organisations. It's about demonstrating a commitment to take action, to hold themselves to account, and to drive positive change outside of the organisation, so with competitors, peers, suppliers. So it's really about, using that transparency to influence change within the organisation, but also externally. So today we're going to focus a little bit about, developing a narrative around mental health and wellbeing. But at the heart of reporting is data. Now, it's perhaps not the sexiest thing. Sorry, Faye, if we can go back a bit, keep on that slide for a moment. So we're going to be talking about data. So data is really about identifying and tracking the measures that will give you an understanding of the state of wellbeing within your organisation, but also how you measure the interventions that you have and the impact that they have. So in today's session, we're going to measure some different sources of data. Now, there are lots of different sources of data, as we will explore. One of the things we're often asked at the City Mental Health Alliance is, well, what is the best data to use? And unfortunately, there is no silver bullet. There is no set of data that is perfect and can give you everything that you need. And quite often, data is coming in from different sources. So the data that you have available to you some of it will be internal. So it may be data that you have on your HR systems, for example, but it's also going to be coming in from different external sources, such as service providers. And we'll explore some of those a little bit later. So I think the question is, where do you start with your data? What can it really tell us? Will it give you a deeper understanding of the state of well-being in your organisation? Will it tell you that the actions that you're taking are having a positive impact? And what you'll be able to measure will obviously depend on the information that you're collecting. And from our experience and what we've learned from our members is really the best approach is to be clear on the goals and the objectives of your approach. And that will help you to inform the data that you decide to use in your reporting. I do just want to urge a note of caution, though, around data that, not all data is accurate, and it has to be really used as indicative or to show trends. So just on that particular point, so for example, you may be looking at absence data to show the number of days lost, for example, for mental ill health related reasons. Now, whether this data is accurate or not will depend upon an individual's comfort in disclosing a mental health condition. It may also be linked to the individual themselves recognising their ill health as a mental health condition. It may also be around the sort of practices within your organisation. So actually somebody may not decide to report an absence, but actually may be working from home. I mean, I suppose that's certainly academic at the moment because most of us are working from home. But so there are lots of different reasons why that data will not be reliable. There's also thinking about what data actually means. So if we think about the absence data example again, I was speaking to a couple of members not that long ago about data and what their data was telling them. And I had one organisation say to me, well, we know about 1 to 2% of our absence is related to mental ill health. Then another organisation said to me, well, we know that approximately 30% of our absence is related to mental ill health. Now, if you look at the surface of that, does that mean that the organisation with 30% of mental ill health absence has a problem? Or does it mean that the culture within that organisation is inclusive and people feel comfortable to disclose? Now, I don't know the answer to that question, but I'll leave that thought with you. The other thing to think about with data is actually what the data means. So what is good data and what does that look like? So if we're looking at wellbeing utilisation, for example, of interventions, a figure like a 10% utilisation may on the surface not look particularly good. But actually, when you're comparing that to other organisations or thinking about that 10% who are benefiting from that intervention, actually, it may not seem as successful as it actually is. So it's just a couple of notes of caution on that. So in terms of the measures that you should be looking at, today we're going to look at key measures that are actually linked to 3 strategic pillars that we've identified in our global Thriving at Work framework, the City Mental Health Alliance. And these are culture, working environment, and wellbeing interventions. So if you wouldn't mind clicking to the next slide, thank you. So if we start with culture, so what is a good organisational culture? So what we would want to be seeing is low levels of stigma associated with mental health and an environment where people, where wellbeing is prioritised by the organisation and the people that work for that organisation. A really good indicator of culture and safety to disclose mental health is your disclosure rates. So do you know how many people in your organisation have mental ill health? Do you even ask the question? Is this something that you have in your monitoring forms? When do you ask the question? Is this something that you might ask at recruitment, but perhaps never ask again? If we think about, mental ill health, the onset of that can be at any time. So in terms of disclosure rates, I think there needs to be a really strong and clear narrative about why you would be asking for that particular information, how it will be used, how it will be reported. Trust is really important here, and I think people need to feel safe that their information is being used appropriately and for the right reasons. Also think about at what point do you ask for this information? I mentioned recruitment, but we would recommend having various points across the employee life cycle. It may be something you want to do annually, asking for people to update their information. There's also another element around disclosure. So things like case studies and storytelling, we've seen that as being a really powerful tool that organisations are using to raise awareness around mental health. And I think the number of people who are putting themselves forward to share stories can be really indicative of the culture within your organisation. And we're going to be talking to Sean from PwC shortly. And I know that they have so many people wanting to share their stories that there is actually a bit of a backlog. So I think that's a really good sign of a very open and inclusive culture. Other sources of data around culture will be around things like engagement surveys. So, what is your engagement survey telling you? What are your employees telling you about their experience of working in your organisation? So things to be looking at within an engagement survey are things like work-life balance, working hours, relationships with other employees, employee satisfaction, management practices. There's also wellbeing surveys. So you might have wellbeing questions embedded into your engagement survey, but you might also be asking or creating specific surveys that are focusing on employee wellbeing. And that's certainly something that we've seen as a result of COVID. And we know that many organisations have either wellbeing surveys or running pulse surveys. And again, this can be a very quick and easy way to get a temperature check on your organisation, particularly when we're going through periods of time like we are at the moment. So we know that organisations have been using these pulse surveys to really check in on people, to identify vulnerable groups, to sense check how people are feeling. When we were talking about sort of going back into the workplace, these surveys can be really helpful and informative for those type of reviews. What feedback are you getting through performance reviews? You may be using different technologies and apps. Are you asking questions around wellbeing as part of that performance review? Other things to consider in terms of culture measurements might be around grievances, people's exits, reasons for leaving. Again, very close to the engagement survey. So, are there issues related to work-life balance, working hours, management practices, relationships, conflicts, discrimination within the workplace? All of these things can have an impact on a person's well-being. So really, really important measures to be looking at. And there's also recruitment candidate feedback. So, even in a short space of time, candidates may get a feel for your organisation and its commitment to well-being. There are also recruitment review websites such as Glassdoor that may also be worth having a look at, because obviously, there may be some feedback about your organisations and the culture within it. Okay, if we can move on to the next slide, please. The next area is around the working environment, and this is really about the way work is done and managed within an organisation. So there are certain types of data. Now, just again with the data, some of these will cross over to the other pillars, but in terms of types of data to measure the environment, absence monitoring. Now, again, this can be, this is indicative of mental ill health across the organisation. As I mentioned before, obviously there are lots of caveats with the reliability and validity of that information. So it's something to look at, but again, just with that caveat. Retention data. So this is really looking at, how an organisation is supporting people with diagnosed mental health conditions. So this could be following a disclosure as part of a recruitment process. This could also be as part of the management of somebody returning to work from mental health absence. So it's really important to look at, well, how long, are there any issues relating to retention from people in those categories? Stress and psychological risk assessments. Obviously, work-related mental health issues must be assessed to measure levels of risk. I would highly recommend having processes in place for people to self-report risks that may be there, and that any risks identified, obviously there should be action taken to mitigate those risks, but those risks should be reported to a committee of sorts, whether that's a risk committee that you might have in place or whether that's another management committee. There's also looking at things like work utilisation and hours worked. We do know that this can be quite hard to measure. However, excessive working hours over long periods can have a detrimental impact on a person's health, so they should be looked at. I think very currently, one of the issues that we're seeing is Zoom fatigue. Now, I think at the very early days of the lockdown and COVID, we saw that there was people saying, oh, lovely, I don't have that, 1.5 hour commute. I don't have to travel into the office. I don't have to travel abroad. And I think Zoom was a bit of a novelty at the beginning. What we're starting to hear now is that people are finding themselves working, spending sort of 8 to 10 hours a day on Zoom meetings, which is not good for anyone. People are not taking adequate breaks. They're not, engaging in physical activity. So we are seeing lots of organisations really looking at that particular issue and putting in steps such as zero Zoom Fridays, creating sort of 2-hour breaks in the day, shortening meeting times, etc. Really to keep on top of that challenge. There's also looking at your policies and processes. So, how inclusive are those of mental health? And then there is benchmarking, and we're going to come on to that in a moment. So if we could just move on, thank you. So lastly, the area in terms of lots of data and input is around the impact of your interventions. So what you'll be looking at here is the participation of people in what we would call the very positive wellbeing behaviours, so that kind of preventative measures and activities. But we'll also be looking at, how, of those sort of support services, so those early intervention services such as EAP, counselling, what is the utilisation looking like for those? Are people increasingly needing psychological support services, because that can be a really helpful indicator of the state of wellbeing within your organisation. For COVID, for example, we know that lots of organisations were very closely monitoring counselling services, EAP services, just to see. We did hear from lots of different sort of voluntary and charitable organisations that helpline, utilisation was going through the roof. We know that on-site counselling, services, particularly across our membership, were being, heavily utilised during this time. It's also, these sorts of interventions are also interventions that we see organisations monitor during periods of change or uncertainty. So, there might be large organisational change. It might be a redundancy programme, for example, that may be going on in your organisation. And these type of data points can be really insightful. So in terms of what you'll be looking at then, so you'll be looking at participation in wellbeing activities and events. So how many people are coming to events? If you have activities running, how many people are engaging with that? If you offer training, how many people are signing up for the training? If you have wellbeing champions, mental health first aiders in place, are their interactions increasing? Are there themes from some of these interactions? If you have on-site services, so I mentioned counselling, but you might have an on-site gym, thinking about, are there more people using those facilities or not? Obviously, catering services, again, in the old world, we might be looking at, the sorts of things people might even be eating, what people are getting out of vending machines. So really thinking about those sort of positive wellbeing, healthy behaviours and trying to support those. Other things to be looking at around, so your website activity. So if you have pages dedicated to wellbeing on your intranet, how many people are, landing on those pages? How accessible is that page? So again, that can be a really good indicator of people's interest, engagement, but also it can also help if not many people are using that site. Maybe it needs to be more centre and front page on your homepage, for example. The other thing just to mention is service provider data. Now, there's some really, really good data that is available from service providers. And I'll just give you an example. So when I was sort of in an in-house wellbeing role, we were introducing an on-site counselling service. And at the time, for our private medical insurance, psychological conditions was around sort of 3 or 4 on the top 10. A year after introducing the on-site counselling services, that dropped to about number 14 on the list. So we could see very clearly through the data that the investment in an on-site counselling service had reduced the number of claims that were going through for psychological conditions. So it was really good data set to show impact. Other things that are really helpful in terms of employee assistance programs. So again, data coming through, you might be able to see what type of things people are contacting the employee assistance program about. Mental health apps and websites, we're seeing sort of an increase in the use of some of these, and these can be really, really helpful as well. So we know some of our members, for example, have identified that, you know, there are sort of real issues in their organisation with people's sleep, for example, and that's come in from different data sets. So they know that in terms of the informing their programme of activity, that actually sleep is something that they should be focusing on. And again, just an example from when I was back in an in-house role, we also had an app that you know, people were encouraged to, you know, take part in, put information in around their lifestyle, and the data we got from that app was actually really helpful in identifying risk profiles. So certain characteristics, you know, gender, age group, that we could again really, you know, identify and inform our programme of activity. Okay, if you wouldn't mind moving on to the next slide. So the next area is benchmarking. So myself and Faye are just going to tell you a little bit about the two different types of benchmarking that we both provide. But in terms of, you know, what a benchmarking will provide you with, so it will be, it's a method to really measure the impact of your programs of work set against a sort of an evidence-based you know, framework that has been developed around good practice. It will help to provide a gap analysis, so identify the areas perhaps that you need to focus on in terms of development of your programme, but it will also identify the areas of best practice that you currently have within your programmes. It will enable you to assess your performance against other organisations. Obviously, that can be helpful in terms of getting buy-in for certain things that you'd like to do within your own organisation. It's a really good opportunity to find out a bit about innovative practice that's going on in other organisations. It's also a really useful tool for internal reporting. So it may be a tool that you can use to measure year-on-year progress, something that you might want to present to senior leadership committees in terms of, you know, a position, a picture of the performance of your organisation against those set benchmarks. It's also, depending on the assessment, but it's also, you know, many of these offer accreditation. So again, it could be something that you can use externally in annual reports, marketing, literature, websites, that sort of thing, to really demonstrate your commitment and the work that you're doing around this particular issue. So I'm just going to say a few things about the CMHA Thriving at Work assessment, and then I'll hand over back to Faye. So we run an annual assessment with our members and also non-members. It is based on the standards that sit within our UK Thriving at Work guide. But in summary, essentially, we are looking to assess your programmes of work against your communication and engagement activities. We'll be looking at your working environment. We'll be looking at people management and the employee life cycle. We will be looking at the ecosystem, so how you interact with clients, suppliers, community, organisations. We look at your leadership and accountability in the organisation, monitoring and disclosure, and interventions and support. And the assessment for City Mental Health Alliance is based on a survey. I have done quite a number of benchmarks myself. So we've done our very best to make this a simple and easy to sort of use process. As a result of completing the assessment, we provide an organisational report and virtual face-to-face feedback and ongoing advisory support. So it's a really, really helpful activity to undertake. And in that report, we do provide quite granular benchmarking information. So again, it's really easy to pinpoint where your organisation sits against other organisations similar to your own. As I said, it's year on year, so it's a really good tool, and many of our members we know do use it as an internal reporting tool in their organisations to measure progress. Anyway, Faye, I'll just hand over back briefly to you.
Excellent. Thank you, Alison. That was really, really brilliant. One of the questions we get asked so much is, you know, what are the sources of data that we should be looking at? And you've just given so many brilliant examples, so thank you. So yeah, just to touch on Mind's Workplace Wellbeing Index very quickly. essentially, the Mind's Workplace Wellbeing Index is a benchmark of best policy and practice. So very much like the 5-minute work assessment, in the sense that what we do is we ask your organisation to take part in a staff and employer surveys, so that we can assess where the gaps lie between the organisation's approach to workplace wellbeing, but also staff perceptions. And we always see that there's quite a gap in the organisations that take part, in terms of what the perceptions are and actually what the organisations think that they're doing well. And then what we'll do is we'll also come in and do a real review of your policies, your procedures, your processes, to get to the grips of everything that you're including in those, make sure they are very conducive to good mental health at work. And we'll provide you with an assessment report with an analysis of the survey results, and then highlight the recommendations for you, and work with you to implement those recommendations through a dedicated account manager. So it's another sort of index that really helps you understand kind of how your organisation are doing. And I just wanted to share with you the assessment areas that we look at, so that you can, even if you didn't sign up to Mind's Workplace Wellbeing Index, you can get an understanding of some of kind of the areas that you should be focusing on when you're looking at this culture piece. So we very much look at culture and engagement. We look at wellbeing initiatives. We look at people management. We look at support, and we look at knowledge skills. But we've also introduced the impact of COVID. I've missed out the D, COVID-19 on that slide. But we've actually introduced that this year, so that we can really start to track the impact that that's having on organisations. And the final step is that you get your index rating. So we have organisations all the way from committed to action all the way through to gold award winning. And we usually run an index awards every year, but that will probably be virtual going forward. But yes, so it's another type of index that your organisation can sign up to. There's more information on the Mind website. But, what we're trying to do as organisations is to come together and really think about the things that we're measuring through these different indexes, so that we can start to really get a sense of actually what the picture is at a macro level across the nation. And for me, that's really, really important, that collectively we're collecting data that can really tell us about the picture of workplace mental health across the UK and globally as well. So yeah, I'm going to hand back over to Alison now, who's going to have a chat with Sean and share PwC's experiences. Oh no, sorry, I've jumped ahead. There's another slide.
Right, okay. Sorry, I've just managed to unmute myself. Thanks, Faye.
Sorry,
yes, very briefly, just to finish off on what I have to say. So I think obviously we've explored all the different types of data that you will or may have available to you. But I think the question now is, well, how do you report that? So there are two different types of reporting. The first one is around the internal reporting. So how are you reporting the data that you have internally within your own organisation? And I think in terms of doing this, there are a few things that I would recommend. So I think firstly, you will have different audiences. So think about those audiences. And it may be that, in developing your reporting, you are going to be creating different reports for different audiences. So for each audience, what you need to do is really think about, well, what will they be interested in? So, for example, a board exec committee might be interested in things relating to risk, cost, prevalence across the organisation. What do these individuals need to know? So, do they need to know the state of the wellbeing across the organisation? Do they need to know whether there are impacts of certain things? So I would expect a leadership committee to be interested in, for example, the impact of COVID on the state of wellbeing in their organisation, whether the, again, organisational change, things that are going on in the organisation, how that's impacting on people. And what do you want them to know? So what do you want them to know about the impact and the work that you're doing? You might want to report on things that are happening externally, so things that you've learned perhaps through a benchmarking process. I would also encourage, obviously, as part of reports, is to provide some narrative. Now, I know, and I've seen organisations creating dashboards with lots of different metrics, but I would actually encourage a bit more narrative and context around actually what the data means. So we talked a little bit earlier about, well, what does good look like? A 10% utilisation of an EAP, for example, may be considered very good, given that the average is around 6 to 7%. So actually, I think it's about providing a bit of context around what some of this data actually means. And then I would encourage you to think about the regularity. So is there an annual report? sufficient for this group? Do you want to have, you might have an annual report to a board or exec committee, but you might want to have a quarterly report for your HR committee, for example, who are a bit more actively involved in the implementation of the programme. So that's the internal reporting. There's also the external reporting, and there are various different ways in which you can do that. So I think the sort of standard, recommendation is, you should be putting something in your annual report. I think obviously that is a very clear demonstration from an organisation about its commitment to well-being. It's really about the organisation putting themselves out there to say, look, we are committed to this. Here's some data to show where we are, talk about the actions that we're taking, and if they're a little bit sort of more mature in the programme, the impact that some of these actions have taken. But also think about different audiences. So think about all the different stakeholders that you might have externally. So recruitment and career, people who are looking for their first jobs in particular. We know from some of the research that we did at the City Mental Health Alliance that actually, a high percentage of recruits are really concerned, and we're talking sort of 60-70% are really concerned about the impact that coming into, say, a city career, so financial professional services in particular, will have on their mental health and well-being. So I think it's really encouraging for them to see organisations that are actively taking steps to support people within their organisations. There's also other stakeholders. So, one of the things that we're looking at the City Mental Health Alliance is around, ESG, and that's environment, society and governance, and thinking about credentials for investors. So, could the well-being of your organisation be considered a measure of your sustainability as an organisation in the future? We've certainly seen that in the case of diversity, certainly things like the Bloomberg Gender Index. So I would imagine that we're going to see more and more of this, relating to employee wellbeing. So it's definitely something to think about. Anyway, I think that's enough from me for now, and I'm really pleased to welcome Sean Maywood from one of our members, PwC. Sean joined PwC in 2016 after a 25-year career in secondary age teaching. Sean initially joined PwC to support the wellbeing of younger staff, but he is a trained mental health first aider now, and now leads on PwC's mental health literacy strategy. So hello, Sean.
Hello. Can everyone hear me okay?
Yes, very well, thank you. How are you doing?
Yeah, not too bad, thank you. Not too bad.
Good. Well, thank you for joining us today. So just to bring to life some of the things that we've spoken about today, I think it'd be really good, Sean, to hear from you about some of the work that you're doing at PwC in relation to reporting. And I think perhaps the first question is, what data and metrics are you using at PwC? We talked about the state of employee wellbeing, but also impact of some of the great stuff that you're doing.
Yeah, and it's interesting actually when you were putting that list, rather that Faye had said, I'd come here with a few ideas, and then I've added a couple of extras as well as I've been thinking about it. So we, in terms of the data that we use, we've got our annual employee survey, our global survey that we use called You Matter. But we've added, since COVID, we've added 2 pulse surveys within that as well, in recognition of the impact of COVID and being able to look at our employee well-being. And there are specific questions within that survey that directly relate to well-being. So it's a whole survey, but there are specific questions relating to well-being, and we've been able to look at those in comparison with April, for instance, and July. We do use our absence data, and again, recognizing that the absence data doesn't necessarily tell the full story, and we would have the same concerns over presenteeism as I'm sure lots of people will have on this particular call. The EAP service was really interesting, and sharing in this forum here, when we looked at the usage of the EAP service, one of the things that we were surprised at was that actually at the start of lockdown it was being used less than it was in the previous year. All sorts of reasons which we probably haven't got time for now, but to sort of suppose as to why that's happening. But it was just really useful to have that data and react, as it were, around the well-being of our staff. We have our our annual health assessments for staff as well. We look at insights from those, and also insights from our other health providers, that our staff are interacting with. So we can use all of that data. But then I thought as well, we do look into our app usage. I got sent a report recently, as you've said. My role is largely specifically around mental health literacy training, and I manage our mental health help app, which I point people towards, and we get a monthly breakdown on that. Recently this has come up, so we can see how people are engaging with it, and training wise, we're pushing for everyone to engage in some form of mental health awareness training, and we're using that data as well, so we can improve that whole literacy, that whole engagement. But I'll pause there for a minute, because I realise that's a lot I've spewed out.
No, that's brilliant. There's some really, really, really good examples there. I mean, you've sort of mentioned, I suppose, data from lots of different sources. I mean, has that been a bit of a challenge in trying to sort of align some of that data to tell a story, or have you sort of managed to sort of crack that nut, so to speak?
It is a challenge, and I think that we've got our survey pretty well organised and run, but I think we would have the same concerns about the data in itself, as you say, EAP usage, whether it's up or whether it's down. Is that a good thing or a bad thing? Is that people are needing it less, or whether people are interacting with it more? So I think we'd recognise that whilst we are getting ever better at managing our data, there's still improvements that can be made. And one of the things we're looking to develop is a tool that we're going to use right across the whole of PwC, which it will be for all of our staff to use, and it will come along with a wellbeing dashboard that they can access as well for themselves. That's not ready yet, but it's something that we are looking to develop.
Okay, no, that's brilliant. Thanks. That's good. I suppose it's something for us all to aspire to. So I look forward to hearing more about that in the future. So no, that's brilliant. So obviously you've got lots of different inputs of data and things that you're measuring. So in terms of the actual then reporting of this, I mean, it'd be good to just understand a bit about sort of how you're reporting that and who to sort of internally, but also what you're doing to report that externally as well.
Yeah. So we report it internally to the executive board. So the full survey results will go to the board, EAP usage as well, and we do report internally to our employees. Again, it may be that we do summarise some of that data. We don't necessarily need to flood everyone with all of the information that is available, but we do report that data. For instance, we report our engagement score each time we do a survey, and we'll report that wellbeing score as well with them. And I was very open with people, both, well, I guess anecdotally, in sharing our insight into the use of the EAP. We have actively promoted the use of the EAP, and again, with the news at the weekend, we've really been keen to remind our staff that it is there for them, not just in crisis. And so actually having some insight about the usage of that and being honest with the staff, because there is perhaps a worry that they're going to overuse the EAP service, we can be quite honest with them and say, no, it's there, it's for you, and still available.
Brilliant. Good.
Externally, I should have said as well, we do have our annual report, and we do talk about our well-being and our diversity, our inclusion, and our environmental impact, for instance, in our recruitment process as well. And we know that for some people, that's what, if you like, entices them towards PwC, is that reporting.
Okay, and that's your annual report's available. It's in the public domain, isn't it? So if anyone's interested in obviously seeing how you've put that all together, it's worth just having a look at your report. Yeah, no, that's brilliant. And one of the other things I know that, we've actually asked you to talk to other members around is around the work that you do to drive accountability, particularly on sort of line leaders within the organisation. So are there sort of any sort of data points or metrics that are used as part of that drive in terms of looking at, measuring performance of leaders in relation to this?
Yeah, this year we've actually got a wellbeing goal. So when people put forward their goals for the year that they're going to be measured on at the end of the year, there is a wellbeing goal within that, and depending on your grade, we'll decide as to how much of that goal is based around your own well-being, and we have made sure that we do push that people do look after themselves, but also as our managers and senior managers and so on, that they consider the impact that they're having on the staff below them as well. So that well-being goal will relate to those, and that fits around our what we call our PwC professional, the whole sort of performance year. People will be measured at the end of the year on well-being as well as the other aspects of that PwC professional role.
Yeah, no, that's brilliant. And actually, it's not something that I mentioned in my presentation, but I do think that's a wonderful way to use data, isn't it, and around personal responsibility, because we all have a responsibility to, take steps to look after ourselves. And actually, it's good to see a data point there, actually, how data is supporting that in the actions of people. So no, that's excellent. And then lastly, I've just got a quick question about benchmarking, because obviously, I think it's a really helpful tool and something that I mentioned I've done quite a lot in my career. But from a PwC perspective, obviously you take part in the CMHA Thriving at Work assessment. It would just be, just the last few words from you, Sean, just about how you use that and, whether it's been helpful in your organisation.
Yeah, immensely helpful, actually, and I think first and foremost, being completely honest as well, it's a great tool to celebrate your successes. So when you do achieve something against the benchmarking, it's really nice to celebrate that and recognise it. But it's great to compare ourselves to other firms and to the benchmarks themselves, and not in a sort of a backslapping self-congratulatory way, but actually what else do we need to do, not just to stay ahead of everyone, but what do we need to do for our people, and benchmark against that. And again, as you pointed out when you were speaking before, it's fantastic to have that, to look at some areas. We are very fortunate in PwC. I think that our board, our executive board, are very, very bought into this. They've been very vocal, very supportive around supporting the mental health of our staff, and we've talked about not just being somewhere where we can support people, that we are actually health promoting, but we can use that benchmarking to point to certain areas and use that with our executive board to focus on areas that we can continue to improve on.
Brilliant. Well, that's wonderful. Well, thank you so much, Sean, for your time. I'm conscious that we've got about 10 minutes left of today's session. So, Faye, I'll hand back over to you.
Brilliant. Yeah, thank you. That was really, really, really great. So yes, we've had some questions in the chat function. So I'm going to invite my colleague Ewan, who's been keeping an eye on it for us, so that we can get on with presenting. Ewan, over to you with any questions.
Yes, hello there. We do have a few. Since we've only got 9 or 10 minutes, I'll start with the quick ones we can tick off fastest, if that's okay. Somebody asked, Sean, what was the wellbeing app that you mentioned? There's somebody who's looking for one for their team, so we'll be interested in recommendations.
Yeah, and I'm gonna probably embarrass myself here with just how untechy I am, but we've got a couple of apps that are what are called wrappers that people can access through their phone, and so they link to two of our internal websites. So one of those is something called Be Well, Work Well, and we call that our one-stop shop, where everyone can access all of the help that we've got available. So it could be from the EAP service, it could be through our health provider, the number there. We've also got some mental health advocates. You can access their names too. And for instance, it will also include details of physical wellbeing activities, so clubs and so on, are all found within that one app, or rather on that one website, but accessing it through your phone. And then we've got a specific app as well, which is the one I get the data around, which is called the Mental Health Help app. And we've developed that specifically for people when they're on the go, if they are worried about themselves or they are worried about someone else, with some simple do's and don'ts, if you like, as to how they should support themselves, support someone else, when they should call for perhaps immediate help, and again, reminders for those numbers such as our EAP service. But those are the two apps that we have specifically relating to health and wellbeing.
Well, thanks. It sounds as though it's more about packaging everything together into one easy place rather than like a brand new intervention.
Yeah, absolutely.
Well, thank you. Another one that's just coming just for you, Sean. Could you talk a little more about the wellbeing performance objectives, the objective grade and manager level? Could you give some examples?
So I mean, I guess it's hard for me to give specific examples, but if we take the structure that we would have when you join as an associate, you would have within our PwC professional, there would be a bullet point, if you like, there around I will take care of myself, and so that will be put into the performance goals. But also we might include training. So we've been pulling together a lot of the training that we've got and trying to formulate it into if you like, a structure for people to follow through in their first few years when they join the firm. And so we've done some work around resilience, quite a lot of work around resilience actually. But we would expect someone when they first join the firm to engage with, say, resilience training to keep themselves healthy, whereas we've got some team activities, team resilience building activities that we would encourage someone at a senior associate manager level that they would engage with, that they would do that with their team, so that they can encourage that well-being amongst the rest of their staff as well.
Well, thank you. So we're getting into quite a lot of specific examples. This is one somebody asked early on to Alison, but I guess it would apply to everybody really. Do you have an example of a culture or pulse survey that you could share? Oh, sorry, I'll just unmute you.
Just unmuted you.
Lovely, thank you. I don't have one that immediately springs to mind, and I think there are probably a whole set of different types of questions that you can be asking around these sorts of things. I would suggest, I mean, just a bit of a Google search would probably bring up some really good examples, but there are some resources actually on the Mental Health at Work site on this particular standard that links to some, and there are some questions that you could use in an engagement survey in one of those resources. I would also look to the management standards and, those different areas and questions that relate to that. So things around relationships in the workplace, control, autonomy, working hours, that sort of thing. Because I think there are lots of different indicators of culture. Therefore, there are lots of different types of questions. But I will think about that. And if I think of anything that comes to mind in the next sort of few hours, I'll ping it over to Faye.
And just also to say, every year Mind publish our Workplace Wellbeing Insights report. So within that report, you're able to see some of the kind of things that we look at, some of the things that we ask, some of the themes that we look at. So looking at some of those reports that are published by Mind, by City Mental Health Alliance, BITC, will give you a sense of the questions that are being asked to employees. So you can have a look at those as a guide as well.
Oh, thank you. So next question, I think we might go in a number of directions, but it was asked just at the point where Faye was talking about the Workplace Wellbeing Index reports and the recommendations that it has within there. So maybe we'll start with that. How effective are the interventions that it recommends in terms of what impact they're having on employee wellbeing?
So do we mean, I'm going to take this question as meaning, does signing up to the index as an organisation actually have an impact on the mental health and wellbeing of your staff? So in answer to that, we've been doing the index now for 3 years. And as I say, every year we release the index insights. So we're able to, so last year we spoke to over 43,000 employees. So it's a quite healthy number of us, a healthy number to look at when we're kind of looking at the impact that we're making. So you can look at the index insight reports to see the changes that are happening at that kind of macro level year on year. But what we've been doing in the third year that we're in the index is looking at organisations that have signed up every year. And actually, we are seeing some really positive trends in terms of how employees are feeling about their mental health and well-being, how they're feeling about how their organisation is supporting them, how they're feeling in terms of work culture, line management practices. And so we've been starting to do that deeper analysis now that we've got that sort of 3-year journey that people have been on. And we are seeing some really, really positive insights. So we've just released our 18-19 index insights, and now we're doing that deeper dive into the actual organisations that have signed up over the 3 years. But from our experience with the index, we are seeing those positive trends.
Well, thank you. That's the end of the questions I have from anybody. Anything anyone else wants to say, or should we hand it back?
No, I mean, the only thing that I would add is that we do miss a lot of hearing about how people are feeling by not being in the office. You know, those chats in the kitchen, the photocopier chats, the kind of, you know, how's your day going? You really do pick up a lot of the organisational culture and feeling in those conversations. So we are obviously missing those opportunities. So I think thinking about how you can do that in this kind of new way of working in this virtual world, so that we're not sort of over reliant on just surveys and things that, you know, are kind of things that people are having to spend time sitting down, focusing on, really thinking about how you can kind of incorporate the conversation about well-being into everything that you're doing, particularly at this time, will help you pick out some of those conversations that you might have been picking up in the office when we were all surrounded by each other. So I think it's just important to kind of think about that and think about how you can kind of capture that stuff as we go forward.
Faye, if I could add on that as well, one of the things that we found was that when people were asking, albeit that there isn't that opportunity to have those sort of throwaway conversations, if you like, that we do actually don't throw away, we value them hugely. At the start, back in March and April, there was a real consensus amongst the staff that people were asking, "How are you?" and really meaning it. And there may be a case that that's slightly drifted away now, as people have, you know, in quotes, got used to the situation. And I think one thing we recognise is we need to get back to that, but it's still a challenging situation for us all. Yeah, completely agree.
Great. Well, I just want to say a huge thank you to Alison and Sean. Your insights have been absolutely brilliant today. As I said, this is the final webinar in the Mental Health at Work Commitment Series. It's been an absolute pleasure. Thank you to everybody that's joined today and joined the series. We are going to be, as I said, putting these onto the Mental Health at Work website. So we want to make sure people can access them for months to come. But it's been really great doing this live with you all. And yeah, I'll end as I've ended every single webinar, but I feel like this week, this is more important than ever to say, just be kind to yourself, be kind to each other, look out for each other, look after yourself. We're all in this together. And please do reach out to organisations like mine, the City Mental Health Alliance. We are here to help you. We want to make sure that, you know, you have our support in making sure that we're supporting yours and your employees' mental health. So have a great rest of the week, and we'll hopefully see you very soon. Great. Thanks, everyone.
Thanks. Bye now.
Bye-bye.